All right. Hi, everybody. Welcome back. This is week 6, Muscle and Physiology is what we'll be talking about. Melissa Best here, and we're going to be going over some muscle points, where our muscles, how they work together, and then we'll be talking about a little bit of a muscle disease as well. So let's dive right into it. We have the origin, and we'll begin there. So the origin is the attachment site that doesn't move during contraction. And so we'll just see my cursor here. We will ignore this yellow highlighted area because that's not where it's at. It's going to be right in this area where it's the point of attachment, scapula, our clavicle, and then humerus bone. And right here is where it's going to be the point of attachment. So this will not move during contraction. Like for instance, if we contract our bicep muscle. And this is going to be basically opposite of insertion, in which we'll move forward into. Insertion is going to be the attachment site that does move when the muscle contracts. The insertion is usually distal or farther away, while the origin is proximal or closer to the body, which is relative to the insertion point as well. So right in this area is not going to move during contraction, as we see in our hip bone here, pelvic hip bone and muscle region here, in this long area right here. And this point is not going to move during contraction, and that is basically because it's going to protect our joints, our muscles, and our surrounding muscles, and along with our bones as well. And so move forward into agonist muscles. And agonist muscles are muscles that are a set of muscles in which some of them contract while others relax. And then the agonist muscle produce movements through their own contraction, and they're responsible for generating specific movements as well. In contrast to antagonist muscles, in which we will dive into here soon. Those are the interfere with the physiological action of one another. So we'll see here that when we contract the bicep is contracted versus the antagonist, which the tricep here is going to be relaxed. And in this video here, we see that the tricep is contracted and the bicep is relaxed. And then we want to move on to synergist muscles. And synergist muscles are also known as fixators, and they act around a joint to help the action of the agonist muscle. The synergist muscles are also able to counter or neutralize the force of the agonist muscle, and are also known to neutralize the agonist muscles when they do. So we'll see that the muscle right here wraps around the elbow, our olecranon, and then that is going to help keep our tendons, help keep our bones and our bicep muscle protective when we contract or when we pick up a weight, let's say. And if you feel your arm when you contract it, you can feel your muscles and your synergist muscles and your agonist muscles and your antagonist muscles all working together, and they all have a specific job. And to go further into the agonist muscles, they produce an opposing joint torque to the agonist muscles. So we see here that the bicep is going to be contracted when we lift our forearm up, or let's say we do a bicep curl with a free dumbbell weight. Bicep's going to be contracted while the tricep is going to be relaxed. And this torque can aid in controlling the motion, as well as the opposing torque can slow movement down, especially in the case of the ballistic movement that's being done. And so all these muscles have specific duties and jobs. So just because it's relaxed, it doesn't necessarily mean that it's not doing a specific job, because it's still protecting our bones, our joints, our other surrounding muscles. It is working in conjoining with the agonist muscles, and same with biceps when they're relaxed when we do a tricep extension in the gym. So we want to move forward into actual muscles and their function. So the muscular system is composed of specialized cells that are called muscle fibers, and their predominant function is contractibility, so to contract. Muscles attached to bones or internal organs and blood vessels are responsible for this movement. So nearly all movement in the body is a result of muscle contraction. Especially like if a woman is giving birth, contractions are basically muscles contracting in order to open up space for the baby's head and body to push forth into the world. So all of these actions work together in contracting with one another. Or for instance, if we are doing a push-up, which we will move into our pectoral muscles, which I want to dive a little bit deeper into our pectoralis muscles. So we have 4 major pectoral muscles: the pectoralis major, the pectoralis minor, the subclavius, and then the serratus anterior. And as a whole, they are known as the pectoralis major, which is the prime mover in the glenohumeral adduction, internal rotation, and the horizontal flexion. As we can see here, we can see the pectoral muscles here, and this is what we look at as a whole. However, it goes a little bit deeper because not only do the pectoral muscles just land right on our chest area, however, it goes further down our arm and up in working together as an antagonist and an agonist, and then also the synergist muscles as well. So the synergist muscles are not just one, there's 3 of them, which is going to be the pectoralis major, which is labeled at number 1 right here. This is going to be the pectoralis major. And then we have the clavicular head, which is the I always say this wrong, coracobrachialis. Say that 5 times fast, which is going to land right around where number 2 is, but just slightly above, because it's going to be the clavicular head, because this right here is considered our deltoid. And then we have the biceps brachii, which is going to be right here as well. I'm sorry, and I think I did that wrong. The clavicular head is going to be the pectoralis major, and then the coracobrachialis is going to be right underneath here. So I'm sorry, I got that a little confused. Going back with that, it's going to be a small little muscle right underneath the pectoralis major, and then in between the biceps brachii. And then we want to kind of go further into the antagonist muscles of the pectoralis group. And so the antagonist muscles are the pector minor muscle, which include the trapezius upper and lower fibers, the serratus anterior lower fibers, and the muscles in the posterior cuff of the shoulder. And posterior is going to be behind, remember. So we're going to look at here, and this are basically our trapezoids in regards to, this is what's going to relax when we're doing a push-up, for instance, while all the other major pectoralis muscles in front will be working together in contracting. And then we want to move forward into a disease known as the Mycenaea Gravis, and this is a condition that's caused by a breakdown in communication between nerves and muscles. Symptoms include weakness in the arm and the leg muscles, double vision, difficulties in speech and chewing. It can happen suddenly, or it can happen through nerve damage or damage to our muscles through an accident. Working in the healthcare field, I've seen patients come in to where they will have a minor paralysis in the facial features, which is weakness and rapid fatigue of the muscles that are under the voluntary control. So as we see here with my cursor, her eye is going to be a voluntary control to where we're blinking, correct? Where the Mycenaea Gravis is affecting her the left side of her facial features. So she does not have control over those muscles. It is a very rare condition. Muscle disease, however, it does happen. I have seen it once out of my 12 years working in the medical field. So I've seen it once. And through therapy, she was able to get majority of her function back of her facial features, because that was happening, I believe, on her right side of her face. And A lot of times this can happen with stroke as well. It can be an underlying cause, symptoms of stroke. However, in her case, it was not, just sudden onset. And so the treatment, like I said, it helps with the symptoms, though this condition can't be cured. So you might be left with some minor symptoms and signs from the Mycenaea Gravis, and which could be tucking in the side of your mouth and not being able to open your eye all the way as much as you're able to open the other eye. This condition can happen in all age ranges and can last for years, or it can also be lifelong. Specific medications can help as well. Physical therapy, nerve ending therapy, and sometimes if it is so severe, surgery can help with this condition, but again, it cannot be cured. I'm just going to move this back. All right, just to move this back up, we're going to go all the way back up to our muscle and physiology, and that kind of gives you an overview of all the muscles and physiology. Well, not all of them, but a good portion of how they work together to keep our body safe and how they work together in making sure that we're able to contract our muscles and also relax our muscles. So every part of our body and every part of our muscles and our antagonists and our agonists and our synergists, they all work together as one in order to function properly. And I thank you for listening to my muscle and physiology presentation, and I am looking forward to week 7 and finals in week 8. All right, have a great day.